Good afternoon. I know we're all a bit sleepy. We've all eaten, and that makes the afternoon a little bit more difficult. But my name is Nicky Lewis. I am the Advanced Care Planning Coordinator for Mercy Health St. Mary's in Grand Rapids, Michigan. Anybody been to Michigan recently? Oh, awesome. So I wish I'd had an opportunity to review the preceding presentation. There's a lot of synergy here, so these are very well matched. So there may be a slight bit of repetition, but it feels like we're kind of going from a macro to a micro level.
You need to fib about it and say we planned it.
Oh yeah, it was all, yes, you're right. It was all totally on purpose. So a little history of, as the Advanced Care Planning Coordinator, I definitely walked into this role a bit naive. I'd worked for Mercy Health St. Mary's for at that time, about 8 years. I had been working on our geriatric unit, which was a new unit for our hospital. And I worked on that unit for about 3.5 years. Prior to that, all of our senior patients were sort of spread out, and we hadn't really noticed any significant trends. Then all of a sudden we had everybody on one unit, and I realized very quickly that senior patients, especially without advanced directives, were challenging, especially when there was not any consensus on decisions. And a light bulb went off. Boy, advanced directives would be really helpful in this situation, and it sort of became my marching orders, and this was even prior to this role even existing in our organization. So I want to talk about creating sustainable ACP leadership through experience. So this definitely dovetails with the previous presentation talking about how we are engaging our leaders. Now, first, I have no conflicts. No one's paying me. It would be nice, but you know, unfortunately that doesn't happen. But I want to summarize a couple of targeted leadership engagement strategies that helped increase support for ACP implementation at our program, to create a targeted intervention for senior and clinical leadership, and identify 2 interventions that promote long-term sustainability. So first, let me tell you a little bit about Michigan. If you've ever met anyone from Michigan and asked them where they're from, it typically starts with something like this. We all use the illustration on your hand to identify where you're from. So Michigan has about almost 10 million residents. Mercy Health, the organization that I work for, services 9 counties in West Michigan. You'll see on the little red arrow there pointing towards Grand Rapids, so it's kind of like about here. We're nowhere near Detroit. Everybody who finds out I'm from Michigan says, well, is that anywhere near Detroit? No, absolutely not. It's the other side of the state. And the population in our service area is a little over 1 million people. Our median income is about $56,000 a year. Our median age is around 37. So a fairly middle-aged population. And you'll see our ethnic demographics throughout those counties is not as diverse as other areas, but we do have a fair amount of diversity in our service area. So our organization. So I'm part of a hospital that is part of a larger organization. As we all know, the trend in healthcare is moving towards these large kind of healthcare groups that can leverage resources and buying power and all those things. So we are a part of Trinity Health, which is serving patients across the country. This is a map of all the states where we have hospitals. In 22 different states, it's 94 hospitals, 109 continuing care organizations, lots and lots of colleagues and employed physicians and affiliated physicians. St. Mary's, the hospital that I work with, is a teaching hospital. We're a medium-sized hospital with 303 acute beds, over 3,500 colleagues, tons of dealing with lots of physicians and affiliated physicians. We also operate 40-plus primary care clinics, which allows us to function across the continuum of care from ambulatory to acute care situations. So we think of ourselves as a fairly good hospital. We've won lots of awards. We get lots of pretty pictures to put in our newsletter, and everyone's very happy, and we think we're doing a great job. I assume all of you are from good hospitals as well, right? We don't have any bad hospitals here, right? Good, good. That makes this so much easier. But our advanced care planning journey was not good, okay? We spent several years just kind of spinning around. The idea of advanced care planning was first considered in our organization way back in 2010. There was a community group called Making Choices Michigan that formed to identify and establish approaches to advanced care planning in a consistent manner for our community, all of West Michigan. And we were part of that. We had members on the board. One of our lead physicians was part of it. And we went to meetings, and we listened, and we took notes. But that was it. We hadn't taken any sustainable or concrete action towards advanced care planning. In the summer of 2014, someone decided, maybe we should start actually working on advanced care planning and making this a part of our system in a more comprehensive and focused manner. So we started talking about developing a program. But even from then, it took quite a while, right? It wasn't until the summer of 2015 when they decided, maybe we need an ACP coordinator to coordinate these efforts. And that was where I came on board. And at that point, we went through the consultation with Respecting Choices and our own local organization, Honoring Healthcare Choices of Michigan, to develop our program. How many of you have implemented the Respecting Choices model and kind of had your pilot team? So everybody's kind of familiar that you select a few small tests of change to figure out how you're going to integrate this into your systems. So that was part of what we did starting in 2015. One difference is we decided that aside from patient populations, it was also very important to include our leaders as one of our target populations. So a little bit different in that we were focusing on having our leaders as members of our implementation team or as a focus group for our implementation. I wish I could say it was all my idea, but I want to share a story with you. So this summary was titled, "When a Discussion is Not Enough." And it says, my 83-year-old mother is a polio survivor, immobile from the waist down since the age of 6. She had spent part of her life in an iron lung as a child. Through the Crippled Children's Foundation, she was able to live an active life, married, working as an office manager, and having 4 children. She was the first person in Canada to drive a hand-operated vehicle. She was told she would never be able to get pregnant and birth her own children, which of course she proved to be totally false. She gave birth to 4 healthy children, with all of us being natural births. Over the course of her life, in order to achieve and maintain such independence, my mother has had more than 50 surgeries. Throughout her complicated medical history, she has signed advance directives and other legal papers to ensure that everything would be taken care of just in case. Everyone was clear in our house. This is what I want. My mother always reminded us kids exactly what she wanted. If she ever had to be intubated during surgery, the clinical team had 3 hours to get it out. Otherwise, she clearly indicated her wishes to simply remove it. As she gets older and fights COPD, congestive heart failure, and the wear and tear that polio has caused to her body, my mother still speaks up for herself, and she is her own advocate and has made it clear that we all need to be advocates for her as well. Her advance directives are filled out, complete with exactly what she wants. She will revisit it occasionally just to make sure that it still reflects her current wishes. She tells us that what we want at 55 might not hold true for what we want at 65, 75, or 85. That sounds like an ideal advanced care planning trajectory, right? This is what we all hope for in our patients. This story was written by Elizabeth Murphy, our chief nursing officer and vice president at our hospital. And what we realized from her story and her passion was that personal experience with advanced care planning was essential. And that was what led to our selection of our team, our senior leadership team, as one of our parties. So, how did we start? We decided, okay, our senior leadership team is comprised of experienced healthcare professionals, right? So they probably know all about advanced care planning, right? That seems like a reasonable assumption. So we sent out some surveys. We used SurveyMonkey, and we're unfortunately somewhat surprised by the results. And that, unfortunately, the level of understanding is not what one might have hoped for and that it would be important for our senior leaders to learn by experience and to lead by example, right? It's much easier to do as I do and not do as I say, right? So this slide is a bit crowded, and I understand we want to keep them low, but I really wanted to share some of those results with you. So we talked about whether these individuals, so we're talking about our chief medical officer, all of those people in the C-suite, everybody that gets paid lots of money to make sure that everything runs smoothly. And we found that about 63% had selected someone to speak for them, which was a good number. We asked how many have discussed those wishes with their own healthcare providers, and only 19% said yes. We asked, have you completed an advance directive? A good, reasonable number, 43%, a little bit more than national average, had done so. We asked, have you discussed those wishes with your patient advocate? Only 53% had actually discussed their wishes with the person they had selected to carry out said wishes. So we were a little concerned about that number. We asked, have you given a copy to your provider? You know, the person that would be charged with making sure your wishes are followed. Only 10% had provided a copy. We did ask if you have given a copy to your patient advocate. 90% did say yes, their advocate had received a copy, which was a little strange because only 50% had a conversation. So I don't know if this was included in their Christmas cards or somehow transmitted without any conversation. But and then have you given a copy to the hospital where you anticipate being treated? And only 13% had done so. So how do we engage these people? Senior leaders are busy. How many of you have tried to get on your VP's calendar? It can take a while, right? So trying to get on their calendars and make those connections was a bit of a challenge. So we had to pull together a team. So we selected our director of our health and wellness department to be the leader of the implementation team that was focusing on this group. She was also assisted by members of our education and training council and our human resources department. We thought those would be the people who could get the right players at the table. We had to find ways to get in their faces. So members of our implementation team did presentations at all of our senior leadership and nursing leadership meetings about a month before the start of our pilot. And at all of those meetings, participants received our complete advanced care planning packets. We put together really pretty materials that we were using with patients to explain advanced care planning, our lovely advanced directive for them to review, and so on and so forth. Then we had to take it to the next step, direct contact. Our implementation team members were each assigned, I believe, 14 senior leaders, and to reach out and make a personal email contact with each one of those. We also had them try to get a call in. Can I get 5 minutes to give you my elevator speech on having an advanced care planning conversation? Of course, that still wasn't enough, so we also set up a booth at our annual employee health fair, handing out information to all of our staff, but especially targeting our senior leaders who at the time were making a special showing because it was one of the first years where we were doing mandatory flu shots, and so all of our leaders went and got their shots first so that we could all participate and be encouraged to do so. So then that still wasn't quite enough. We had our chief nursing officer, whose story I shared with you at the beginning, also sent out a message, a reminder to all of our members of senior leadership, hey, if you haven't done so already, please reach out and schedule your conversations. And then we also had a final reminder email. So that seems like a lot of effort. We should have captured every single senior leader, right? That wasn't quite the case, but we did have some fairly decent responses. So 33 senior leaders were offered facilitated conversations. 67% did come in and complete conversations. So, and what I do want to preface because there had been a fairly large number who reported that they had completed advanced directives. And just as a side note, many of those were forms that had been completed in an attorney's office with their estate planning packets, and sometimes people don't read those lengthy documents, so we were asking people also, even if you have an advance directive, to come in and have them reviewed and go through the conversation. We had 42% of those who participated had their patient advocates present. 70% completed all or part of their advance directives, and I want to explain that part of. In the state of Michigan, our witnessing requirements, you have to have 2 witnesses that are basically not related to the patient, not any hospital employee, which pretty much eliminates everybody who's in the room at the time, and you have to have people take it home and ask their neighbor or somebody at church on Sunday and bring it back. And then we had 24% of those completed advance directives uploaded into the EHR system. So what did we learn? Some important things. Managing the personal, professional barrier. All of our facilitators were hospital employees. We unfortunately realized that there was some discomfort or hesitancy to have such a personal conversation with coworkers. So that was one of the things that we learned, and one of the responses we got back when we asked, well, if you didn't have a conversation, why not? The methods to try and engage our senior leaders was fairly labor and time intensive. As you saw in the previous slide, we made had several initiatives to try and make contact with those individuals and engage them in the process. And the last thing was managing the data. This was our first implementation, and we just didn't have a really good data management system, because these weren't conversations that were happening as a part of like a physician office visit or an inpatient admission. So, all of those wonderful tools that are in your EHR system to try and collect this information and manage the data weren't available, and we were kind of struggling to address and maintain that information. So, were there any positives? What were our results? We sent out a follow-up survey after 6 months to all of the participants, whether they had come in for a conversation or not, and to assess their level of understanding. We definitely had a measured increase in understanding of advanced care planning. The respondents indicated that they felt that they were better able to communicate with both patients and colleagues about advanced care planning, that they had a greater empathy for the patient experience in going through this conversation, how intense it could be to have these very personal conversations that admittedly we're all usually very uncomfortable with. I personally plan to live forever, so I had no need for an advance directive, because why? But we really understood how difficult it was. There were a lot of our senior leaders who spoke about just some of the uneasiness they felt when approached with this, and better understood how patients would also perceive these interactions, because we sometimes get that idea, and this is not just with advanced care planning, but other healthcare needs. Well, we're telling patients this is the best thing, why won't they just do it? So this helped our leaders better understand and communicate that empathy for our patients. And they also reported that they valued the mission of advanced care planning. All of our respondents indicated that they now understand why this is so important, why we're pushing for advanced care planning, and what the value is to our organizational mission and to our individual patients. So I wanted to leave some time definitely here for questions. I know we've got about 10 minutes left, and there'll be some time. So any questions about our implementation?